performing one single phase of the entire cardiac cycle. Number two, this is a pre-acquired image. So there is a time lag between the acquisition to the time that you put the procedure. Number three, the position of the patient was not the same. Most of the CT labs, if you send them to radiologists, they put the arms up in the head. Well, that's not the way you put the patient in the cath lab. So all these can change your registration and your validity when you try to use that information in the cath lab. So the acquisition of the image has to be planned ahead of time if you are going to use that in the cath lab as a co-registered image in order to be accurate. So we have developed a whole series of protocols for the acquisition during for patients in TAVR or any structural procedure that we do. And then we do exactly what you see here. We do register by, if there are no internal landmarks, by injecting usually 5 cc's of contrast in the sinuses, or we can shoot in the coronaries, and that will allow us to do the co-registration in a very reliable manner. Now, the dots that you see here are the dots that were put by the pre-planning. And based on that, we have a plane of deployment. The plane of deployment is the circle that you see in yellow. So in order to be absolutely perpendicular to that plane, you will convert that from a circle or an ellipsis that you see now, depending on how you move your fluoroscopy tube, into a single line. When you reach that single line, will be exactly the ideal plane for the deployment. There we go. So now you can see that the plane is basically, that circle has been converted now into a single line where all the 3 dots that you were seeing before are aligned. And that's where we want to start deploying the valve. But again, you see the difference because one is in a real-time fluoroscopy, the other one is the pre-acquired image. So there is definitely a difference between one and the other, being single plane, single phase representation on the fusion versus the real time. But it does confirm very well, as you can see here, during the deployment of the valve. And the main advantage is that obviates many of the multiple injections during the deployment. It is now so reliable that we've done patients with severe renal function impairment where they had previous CT acquisitions, and based on that, we were able to do that deployment with very minimal contrast during the procedure. Now, you saw from Dr. Zamorano also how do we use the fusion of the echo. This is real time. That is the big difference. This is not a pre-acquired. What you see is what's happening at that time. And I can fuse the 3D echo, TE, or TOE, they call them here, with the fluoroscopy in real time. And allows me also to overlay the physiologic information. So I can see color flow Doppler superimposed onto the fluoroscopy, and I know whether I have a leak and in what part of the valve I have a leak. And I can correlate that very well with the fluoroscopy. Now, not everybody has this technology. And do we really need that co-registration and fusion to be able to deploy the valve at the right place? Well, there is a new technology that has been just recently approved by the FDA and also by the CE mark. There is a simple wire that has 3 loops, and basically that is the wire that is used for the deployment of the tabby. And it's an analog locator that is embedded within the guide wire. And it has 3 markers that you can see on fluoroscopy, and you can pull and fix them underneath each of the commissures. And here is, we did the first in men about 4 weeks ago. We've done just a handful of patients, but we found that correlating this wire with the fusion imaging technology, there was an excellent correlation. And basically, when you see those 3 dots of markers of the wire aligned at the commissures by pulling, they correlate incredibly well with the pre-planned angulation for the plane of deployment. So, in summary, is there a real need for imaging registration for TAVIs? And the answer may not be in all the cases, but it certainly helps if you have that. Thank you very much.